Patient in supine in the against gravity position. The arms are placed above the head and the elbows are flexed. And the mat stabilizes the trunk. And if the patient has weak abdominals and is not able to fixate the thorax on the pelvis, the therapist will stabilize by placing a hand on the top of the chest. You can feel the sternocleidomastoid proximal to the clavicle or sternum, and the scalenes can be palpated above the clavicle and behind the sternocleidomastoid. The patient flexes the head and neck, so I'm going to ask the patient, Emmy, move your chin towards your chest by lifting your head. Because the patient is able to move through the full range of motion in the against gravity position, she starts out with a score of 3 out of 5. So again, Emmy, move your chin towards your chest, flex your head. The resistance location is going to be applied to the forehead, the top of the forehead, and the direction of my resistance, I'm going to push the head towards the mat. Ready? Don't let me push. Okay? Because the patient is able to actively move through the full available range of motion against gravity and against maximal resistance, which I placed on her forehead, she receives a grade of 5 out of 5. The arms are over the head, resting on the mat, and the elbows are flexed. The patient is going to grasp the end of the mat, while the therapist is going to stabilize the upper thorax region. Emmy, extend and rotate your head to the left. Good. She did it through the full range of motion in the against gravity position. She starts out with a score of 3 out of 5. You can extensor muscles as a group around the vertebral column. Back of the head, and I'm going to apply it downward towards flexion, and I'm going to push it as if I'm trying to push her head to the right. Don't let me push. Because the patient was able to actively move through a full range of motion against gravity and against maximal resistance, she receives a grade of 5 out of 5.
The patient is sitting or supine. In sitting, the forearm is supinated and supported on the table. The wrist is in neutral position or slight extension, and the fingers are extended. The therapist stabilizes the metacarpal and the proximal phalanx of the finger being tested. So I'm going to use the middle finger. Flexor digitorum superficialis is palpated on the proximal phalanx here, or on the vulvar surface of the wrist between palmaris longus here, and flexor carpi ulnaris tendon here, so right here. So I'm going to use this finger, so other fingers are extended. Now tell the patient to flex PIP joint while keeping DIP joint straight. So going like this and keep this part of the finger straight. So flex it for me. Good. Since the patient is able to flex the finger through full range of motion against gravity, she receives a grade of 3 out of 5. The vulvar surface of the middle phalanx. So here. Middle phalanx. And tell the patient, don't let me move your finger. So don't let me move your finger. Good. Since the patient is able to actively move through full available range of motion against gravity and against maximal resistance, she receives the grade of 5 out of 5. This patient is sitting or supine. The forearm is supinated or in mid position, supported on the table. The wrist is in neutral position, and MCP joint right here, are extended and abducted, and IP joint, right, PIP joint and DIP joint are slightly flexed. The therapist stabilizes the metacarpal right here, and tell the patient to flex the MCP joint while simultaneously extending the IP joint with this motion. Good. So go ahead and flex. Good. The fingers are allowed to abduct to prevent assistance from adjacent fingers in static adduction. Since the patient is able to perform the motion through full range of motion against gravity, she received the grade out of 3 out of 5. The lumbricals are the muscle that we're trying to palpate. The lumbricals are not be able to palpate it. Resistance location is the vulvar surface of the proximal phalanx and the dorsal surface of middle phalanx. So again, stabilize the metacarpal and do this motion again. Good. So the vulvar surface of the middle of proximal phalanx and dorsal surface of the middle phalanx, just like this. And don't let me move your finger. Good. Since the patient is able to actively move through full available range of motion against gravity and against maximal resistance, she receives the grade of 5 out of 5.
The patient will be seated in a chair. When you're testing the dorsal interosseus, which I will be for the index finger, the forearm will be pronated and supported on the table. The wrist will be in neutral, and the fingers will be extended and slightly adducted together. The dorsum of the hand over the metacarpal bones and the wrist and lateral 3 metacarpals. The adjacent finger away from the finger that's being tested may also be stabilized. So that would be this digit. So I would ask the patient to abduct their index finger towards their thumb. You made the thumb? Go ahead. So that I see she's able to complete the movement through the full range of motion. I would palpate the dorsal interosseus muscle, which abducts the first digit here on the radial aspect of the second metacarpal. I'll provide resistance against the proximal phalanx of the digit that is being tested. Move your index finger towards your thumb and don't let me push you in. Very good. So she was able to complete the movement against maximal resistance, which would give her a score of 5 out of 5. The patient would be sitting, or she could be in supine. And if she's seated, which she is, I would have the forearm supinated and supported on the table. So you could supinate. The wrist remains in neutral, and the fingers are started out abducted. The metacarpal bones and the wrist, like so. The adjacent fingers towards the test finger may also be stabilized to prevent any substitution movements. The patient will be performing adducting the index finger towards the middle finger. I will provide resistance against the proximal phalanx of the digit being tested. I'm going to ask you to move your index finger towards your middle finger and don't let me push you out. Okay. Go ahead. Very good. As you can see, she was able to complete the movement with maximal resistance, which would give her an MMT score of 5 out of 5.